Yeah, so we started a pandemic relief fund right away. We knew there would be unmet needs in the community, even after federal dollars come in. So donors have given to a couple different areas. One, to make sure kids aren't going hungry. Bob Cooper and his family gave a personal gift of $100,000. And so we're actively trying to figure out how can we reach kids who are not getting to the meals provided by Bismarck Public Schools or Mandan Middle School or Mandan Public Schools, or Adopt a Block, et cetera, Soup Cafe. There's a lot of people doing a lot of great things, but how can we reach the kids whose parents might not be getting them food? So that's one area, making sure people aren't going hungry in the community. Homelessness is another big area. So some of the funds were directed towards security deposits, rental assistance, increased expenses at our shelter. I mean, just thinking about all the cleaning products and supplies that we've needed, our supplies or our expenses have increased tenfold. But then our third priority are our partner agencies. We make investments in them every single year, and they're having a hard time raising money. Uh, we're lucky we haven't seen that problem yet, but we know that the pandemic is going to affect all of our nonprofits and people in need. There's going to be more people in need just because of the economic factors involved. And we also know that, our United Way, we weren't able to hold a lot of the events that we used to hold,
Yeah,
and we're not going to for quite some
yeah.
time. And so to be able to grant funds to other nonprofit partners is also a big area. We just had a meeting this morning and we talked about some of those unmet needs in the community, some of the increased expenses, and really encouraged our partners to apply for those funds because we're here for them.
So I know you mentioned like partner agencies. Can you tell me who some of those are that have been getting some of that funding?
Sure. Charles Hall was one of the first ones to apply. They do a terrific job, and they're having just some really big mandates that have come through federally. And so they're having to change a lot of things with their program.
Moving forward, I know that you said that you're trying to get everybody out of the temporary shelter right now. So what do you mean by that?
Well, congregate living is not safe. We're looking at what's happening in other communities to the homeless population. And in other communities, they're choosing to be out on the streets because they're so afraid of contracting this virus because they realize they're going to end up in the ICU and might not make it out. So the best bet is to help the homeless get into housing as soon as humanly possible. So we've reduced our numbers, and the folks currently at our shelter either have a criminal history and aren't able to secure affordable housing locally, or they might need more support and they might not be willing to ask for or receive that support once living independently. We've just had some really, really sad cases of people that really need a lot of help and are chronically homeless and are in their upper 60s, and they really don't have a lot of choices right now. And so we are committed to keeping our 24/7 shelter operating. We're committed to upholding our agreement with the city of Bismarck so that the police, we're trying to reduce the burden on them, and they always have somewhere to bring the homeless anytime, day or night.
What does the future look like for, emergency shelters? Are there plans to, build more, or what's going on with that? Do you know?
Uh, the pandemic really exacerbated the current issue of United Way needing a bigger permanent homeless shelter to meet the needs for Bismarck Mandan. We purchased this property with Community Works of North Dakota, and our intent was to build on. So our board just made a decision to embark on a capital campaign. We absolutely need to be able to isolate people in rooms and have individual rooms to put people in. Um, Especially if someone tests positive. Right now, our current shelter doesn't have that capacity. We need more space. We need more family-friendly space so that, when we have kids, we had a mom who had a 2-year-old with pneumonia. We
Mhm.
had another mom with 2 little babies, 2 little children. One of the babies had RSV. And so the best thing we could offer was to set them up in hotel rooms. We had people with COVID-like symptoms at the start when they weren't able to access tests, when tests weren't readily accessible. We put them up in hotels. But we really need a permanent and a larger shelter. And so we're hoping the community seems to be really excited about it. And we're hoping that, we're able to get some big donors to sponsor some space.
That's great. Is there anything else you'd like to add that maybe we left out? Anything you want people to know?
We're so grateful to the community for supporting our efforts to help the homeless and to keep them safe, help kids not go hungry. The bistro donated 800 meals that we delivered to some of the formerly homeless people at our shelter that we placed in apartments. We had Outlick donate bedding, furniture, bedroom furniture. We had kids have a lemonade stand, the Verdows, and donate funds so that kids aren't going hungry during these really difficult times. So it might seem like a little bit, but every little bit really adds up to really know that people are there for those who are really in need.